Speakers today, one well known to us, the other from Pinnacle, so I'm going to give a quick introduction of both and then turn it over to Sally. Sally Dixon joined Memorial Hospital in 1981 as the Vice President of Finance. She holds a bachelor's degree in accounting from Ithaca College, where she graduated summa cum laude. In 1995, Sally was promoted to her current role as CEO of Memorial Hospital. Actively involved in the community throughout her career, Sally has served in leadership roles for numerous nonprofit and professional organizations, including the American Heart Association, American Red Cross, Better York, Cultural Alliance of York County, Hospital and Health Systems Association of Pennsylvania, Junior Achievement, Susan Burns, and I've seen her on a lot of these boards, so she does a great job. Team Pennsylvania Foundation, United Way of York County, York Adams Area Council of Boy Scouts of America, and the York County Community Foundation. Sally has received many honors and awards, including the National Athena Award, the United Way Distinguished Service Award, the Boy Scouts Distinguished Citizen Award, and in 2010 she was named one of Central Penn Business Journal's Women of Influence. Our second speaker is Dr. Thomas Stoner. Dr. Stoner is Vice President of Hospitalist Services for Pinnacle Health. He attended medical school at Kirksville College of Osteopathic Medicine and completed an internship in his residency at Pinnacle Health. Dr. Stoner is board certified in internal medicine and serves as medical director at Pinnacle Health's Community General Osteopathic Hospital. Recently, Dr. Stoner was appointed sepsis champion for Hospital Association of Pennsylvania, and he has worked diligently to increase awareness of sepsis, one of the leading causes of hospitalization and death in the United States. And just a footnote, Dr. Stoner pointed out that Pinnacle Health Service is currently in the top decile for sepsis care. So I will turn the program over to Sally Dixon.
Good afternoon, everyone. You can tell how old I am based on the length of the introduction. So it's great to be back in front of so many of you that I've known, and I was a member of the club for many years and hope to regain that membership status soon. So we're going to start today with a little bit about where we've been and what's brought us to where we are today. Where'd my technical person go?
Right here.
It's not working.
Is it turned on?
Oh, there we go. No, we got it. So today we are a 100-bed teaching hospital. We have teaching programs and residency programs in emergency medicine, general surgery, OB-GYN, family medicine, and orthopedics. We have a standalone surgical center along with a standalone endoscopy center and a medical center out on Greenbrier Road that offers diagnostic testing in addition to the hospital itself. We have 9 affiliated family medicine practices. They are located throughout the county, from Shrewsbury to Stewartstown, Red Lion, Manchester, and a number of them in York proper. We have 8 additional affiliated programs, including our OB practice, cardiology, neurology, general surgery, urology, and pediatrics. Those are all practices that are actually owned by the hospital and the physicians are employed, as well as infectious disease. We're currently employing about 750 employees at the hospital and another 100 within our practice locations. And we have over 100 medical staff, active medical staff. The total medical staff is around 250. Just to give you a sense of size, the very first line, I wish we had 9,000 total admissions. That includes observations, so it's split about half and half, about 4,500 admissions and about 4,500 observation cases. Observation cases is kind of what would have been admissions in the old days are observation cases now because the Medicare program doesn't want to pay for an admission stay. So those are included in the numbers there. Primary care visits, around 64,000. We've been able to grow our specialty practices to over 17,000 visits. Emergency room visits we're very proud of, almost 45,000 we're doing out of a 100-bed hospital, which is fairly significant. Surgical procedures, which includes all of our GI procedures, 6,900. And you can see the rest as we move down through. Our heart and vascular program, we're doing PCI. We work under an exception from the state, and we're accredited to do that. We are also accredited as a primary stroke center. Oh, went too far. So just a little bit about how we got here. We looked at population growth within New York County. We're one of the few counties in Pennsylvania that continues to grow. And we made a decision that we needed to expand our facilities. So we began looking for a site capable of handling that. Most of you know that we purchased the Hawk Lake golf course a number of years ago. And from that, we've been able to start to create a campus. 127 acres was bought in, like I said, late 2008, I think it was. In 2011, we announced a strategic partnership with Community Health Systems out of Franklin, Tennessee. And part of that acquisition and partnership was to build the new facility, which did get started this past May. In May of 2016, we started all of the site work, and so we'll be talking a little bit more about that later on. But now it's brought us to the point of another change in ownership, one that I think is going to be extremely beneficial not only to Memorial but also to our community, and that's by Pinnacle Health. And that's anticipated to take place in July 1st of this year. So we're very excited about that. It does a number of things for us and our community. It puts us back as a community asset. We will be moving back to a nonprofit status. I think that the connection to community, because Pinnacle is part of central Pennsylvania, is going to be huge for us. And the culture and the values of how they operate their system is very similar to the way Memorial does and has. And we are extremely fortunate, I think, to end up with a partner like Pinnacle. So with that, I'm going to turn it over briefly to Dr. Stoner, who's going to talk to you a little bit about Pinnacle today.
Firstly, she's the serious one. I'm more of the jokester. But in all seriousness, you know, what a pleasure to be here. Thank you for inviting myself. Sally's one of the community. I grew up in Adams County, so it's nice to kind of get back in the area. But what an honor to be able to participate in song and pledge and prayer, which are really very important to me as a prior military officer who served this country for 7 years. So thank you very much. And it's with that same heart that I come to you today, and really we've reached out with York Memorial and our in affiliation in creating a team there that I think you'll be very proud of. I'm not going to read these verbatim. You can kind of look at these and see that Pinnacle Health is a large facility. We're over 600 beds, and we are at 90% capacity at almost all times. Tertiary care center, with the exception right now of neurosurgery, but that is forthcoming. So a very busy place on the inpatient as well as outpatient, and multiple ventures with ambulatory surgery. We also have an acute rehab and a subacute rehab affiliated with our hospital. We have an LTAC and a subacute. We do a variety of things with home infusion, occupational medicine, and also have an affiliation with our psychiatric hospital up there. As you can see, our current net operating revenue exceeds $1 billion. I think we passed that within the last 2 years. So a large system. You can see by the size of the admissions, approaching 40,000 admissions, very heavily involved with the hospitalist care, so it rings in my mind that we dealt last year with roughly almost 38,000 discharges. Our team of hospitalists are the largest of our admitters within the hospital, and we manage about 70% of the admissions and consult on a very large percentage of those that we don't primary manage. Just to highlight a couple things here, our cardiovascular team is known as some of the best in the nation. We have done the most valve procedures of any other system our size have won multiple awards. And last year, we were in similar areas as far as numbers go in our region and had the lowest post-CABG mortality at 1%, which is something that I'm really proud of, because as a physician, I really come into this with a servant's heart. And being called into medicine, it's one of these areas that we're really proud of, that we want to do patient care well, and we want to put patients first. As a representative of our CEO, Phil Garnishelli, and working with Sally, our whole desire is patient care and the best possible care that we can provide. We want our families to go to these hospitals. I have 4 children. I have 2 wives. I have an ex-wife and I'm just kidding. But you know, once you get married, you never, you know, no raising of hands, please. So pretty busy. Key accomplishments, as you can see, we've been a system, one of the only systems in the state to be certified by the Joint Commission in all of these programs. You can read those. Ranked in the top 5% in the state for the number of joint replacements, that's hip and knee, heart catheterization and stenting procedures. Another neat thing that we just started doing within the last couple of months is this procedure called the Watchman procedure. So it's this catheter-released small balloon that is placed in the heart. It's placed usually through the vein in your leg for folks who have AFib, and we want to get them off Coumadin or Pradaxa or anticoagulants. So we place this small little balloon in the heart. It seals up a little hole where clots usually start that can cause stroke. And once that Watchman device has been in place for several months, you no longer need to be on anticoagulant. Pretty neat stuff. No more GI bleeds, no more protimes, no more Coumadin, no more food worries, vitamin K. So if anyone, I mean, I'm sure we've got several people. AFib is the most common arrhythmia that we see as we age. So it's not uncommon. I'm sure I'm speaking to some folks in here who have that. I'm willing to consult at the end of the program for free on the Watchman procedure. Neat stuff. Key quality initiatives, of course we had to put knockout sepsis up there. They call me the sepsis king up there. I just have a passion for sepsis. I'm actually a psychopath when it comes to sepsis, because 2 of my 4 children almost died from septic shock. My middle son, Aaron, who's 18, he just got into the University of Pennsylvania. He wants to study medicine. I keep trying to talk him out of it. But he had very severe pneumonia about 2 years ago and almost died. And my daughter, my oldest daughter, Ashlyn, who gave birth to my first granddaughter last year, now this time, almost passed away after giving childbirth out in LA. They both were in the hospital for 2 weeks. My eldest daughter just has fully recovered a year out. So just a little comment about sepsis. It is the most common killer out there in the nation and in the world, and it costs the most. Right now we spend over $24 billion on sepsis care nationally in the United States, and it is the greatest cost for the federal government. So when you think of sepsis, you think of infection, stomach infections, urinary tract infections, pneumonia, skin ulcers, skin infections. When those things get infected and you get really sick, you become septic. You can see other things we've done here. I'm not going to read through those, but we are very aggressively pursuing the opioid crisis that we see nationally, with a reduction in, first and foremost, physicians prescribing narcotics. A lot going on here with the execution as a central hub. So Harrisburg Hospital, we're looking at and collaborating with all of our sister hospitals as that being our tertiary and or quaternary care center. And really, what you can take from this slide is we want to be the folks who say yes. We want to ensure that we have the size and the bed availability, so when one of Sally's doctors calls us, we can say, send them our way. We'll manage their valve surgery. We'll manage their neurologic complications. If they need long-term or LTAC rehab, we can help. So we want to be partners with these hospitals that we're affiliating with. This is not a hostile takeover. This is something that we do, again, from a servant nature, but also realizing that the larger our footprint is, the more we can contract with insurances and try to do our best to make healthcare cost reduce. So the triple aim is better quality, lower cost, greater accessibility, and the fourth part of the triple, which is now the quadrupling, is physician burnout, which is huge. Physicians have 2 times the amount of suicide rate compared to the national population. So, benefits to the local community. We kind of talked about the vision. We really want to be a center of excellence. We want to ensure that all of the hospitals that we merge with and affiliate with shoot for that same portion of the target. I don't have much else to say. I'll let Sally get back up here for the remainder of the slides. I will give one plug to Dr. Salk and Dr. Sabin. Does anyone know who those 2 doctors are? They're no longer living. How many people know Dr. Salk and Sabin?
This is a Rotary club you're at?
Yeah. So as soon as you started talking about polio, you know, it took me back to my roots of history, and I love the history of medicine and how Salk and Sabin were instrumentally involved with the development of the polio vaccine, which we say we've eradicated. We haven't completely eradicated, but darn near close. So thank you for your work there. Thank you.
I think you can see from some of the clinical side of things why we're so excited to become part of Pinnacle and be able to bring many of the services that they offer to our own community and partner with such a great group of people. So the new Memorial Hospital, we did break ground last year. This is an overhead view. You can see to the right-hand side of the screen, that's what we call Old Memorial Way. We actually had a naming contest amongst our employees to name the ring road, and one of our gals in HR won the prize. And it's interesting, her daughter said to her the other day when they actually were looking at this picture, she said, "Mom, just think, when you're gone, we'll still be able to drive on Old Memorial Way and think about you." She's only 45, so. And her daughter was 6, I think. So site preparations began, and we've completed really all of the road work, all of the curbing. This particular aerial view doesn't show, but all the street lights are up and whatnot on the ring road. All of the utilities have been brought there, so there's been a lot of work done. A lot of ground moved. Over 1 million cubic yards of earth have been moved on that site. And for those of you that remember when it was the old Yorktown, I think they probably moved that much to make it Hawk Lake because they built a lot of those hills and whatnot, and we've moved it yet again. The ground floor level has been excavated and is ready. Building pads have been put in place that house the main utilities. And the construction date for starting is anticipated sometime late summer, early fall. We were at a point of almost pouring footers. Steel had been ordered. We were fortunate that we had an opportunity to stop in place. And we're reworking the plans to some degree with the folks from Pinnacle now. I will tell you that I think it will drive a much better facility. It's going to give us sustainability into the future and really starts to look down the road at what we need. And so we're extremely thankful that we were able to do that and put our mark on it as well as the Pinnacle mark. Local project partners, Stantec is the architect. They are out of the toward Philadelphia, Quandel, Barton Associates, and Dogwood Engineering. People ask me a lot about the roads around it. So on Roosevelt, if you're familiar with Roosevelt and you start at the Weiss Market or at 30, you pass the Weiss Market, kind of work your way up the hill, and if you look to your right, you see City View Church, which sits way up on top, and you hit kind of a blind corner. Right around that corner, part of that will be shaved off so that you can actually have visual sight, and there will be a red light, traffic light established there. There will also be a new turn lane put in for Roosevelt, and there was a widening of Roosevelt to allow for better traffic flow up through there. I think the biggest change there, and probably the most significant from a safety concern, is to kind of stop that traffic that comes down through there at lightning speed, and you can't really see when it's coming at you. So that'll be corrected. The other entrance into the hospital and to Old Memorial Way is off from Welsh Road. Welsh Road has its challenges as well. People kind of fly off Route 30 and head down that road. That will be straightened somewhat at its bad curve, and there will be a widening of the turn lane into the hospital, and most of the widening of the road will occur to the north side, which is coming out of the hospital property as opposed to the property associated with the homeowners. We spent a fair amount of time with the West Manchester folks and the people who live in that area in establishing a solution that worked for everybody, so in a collaborative method. This picture isn't quite right because all of the widening really is coming off from the hospital property. We also did a fair amount of work in reworking drainage in that area to facilitate better flow of the runoff so that it doesn't end up in the yards of the people who live across from us, our neighbors. So about the hospital itself, it will be 102 beds. A lot of people say, well, you're 100 beds now, how does that make it better? They will be all private rooms, so instantaneously you get an uptick in your utilization because you don't have to cohort male and female, infections, non-infections, those types of things. And we have a number of our beds that are on a restricted floor right now, our OB floor, because of the way we're designed in our old location. We can't really bifurcate that floor, so we'll pick up more med-surg beds, and we'll reduce the number of OB beds, which is what we're using now, but give us expansion in that area as well. So we will see an uptick in our available space. All of the rooms are private, as I said. The private rooms that we're anticipating in this facility are actually bigger than our semi-private rooms currently, about 30% larger, and they're a good 60% larger than our private rooms are in today's facility. New emergency department will have some increased availability in the emergency department. It will allow us to grow some there. The other thing I like about the design that we've put together is that there's huge opportunity for instantaneous expansion, if you will. When I say instantaneous, I mean that you don't have to stop what you're doing in a department to be able to expand that department. So the design has been created so that there are specific places where we would expand without having to interrupt current operations. So that gives us huge opportunities to continue to grow. We'll have 6 ORs. The ORs are more than double the size that we have in the current facility. I think we're at about 350 square feet in an OR in the current facility, which is way below standard today, but it's an old facility, and these will be over 800. 1 hybrid operating room as well. One service that we're adding, in addition to expanding the cardiovascular services, will be a level 2 nursery, which is referred to as a NICU, and there'll be 4 spots in that. The inpatient units are all designed in what's considered to be the most efficient design today, which is a racetrack design, so that you have visibility of most of your rooms from the caregiver station, so that you can actually visualize your patients, as opposed to, if you think about our facility today, it's one long hallway, double loaded, so there's rooms on either side of the corridor. The travel distance for a nurse can be up to 265 feet in our current facility. In the new facility, it'll be around 60. And people say, well, you know, so what? Well, the average age of a nurse today is over 50 years old. And if we want to keep nurses there to take care of all of us as we age, then we need to make their jobs easier and less traffic for them on a regular basis, both crossover traffic and the number of footsteps that they take in a day's time. Everything's ergonomically designed. Things like a pneumatic tube system that helps with efficiency, so things can be transported from the lab to the floors. Those are things that we don't have in our old facility. Our facility was built in 1960. I think we occupied in 1963. And so most of those features that existed then still exist, and new features aren't easy to add, for sure. So that's the new facility. We are extremely excited to get underway. We anticipate being in the new facility by 2019, and we're excited to continue to serve our community. You our hospital has gone through many changes over the years. In the 1940s, it was started by a group of businessmen and osteopathic physicians who felt like it was important to provide competition in our community. They started as a for-profit hospital. About 3 years into it, converted to a nonprofit hospital. We were acquired by CHS, became a for-profit hospital, and now we're migrating back to a nonprofit hospital again. So there's been lots of change. I think change that's been meaningful to the community. Our board of directors, before the CHS takeover, looked to try and create some sort of sustainable health care for our community, to provide a second provider in the market, to provide competition, because we believe that competition is extremely important for all of us. It raises the level of quality, reduces the cost associated with that, and continues to give people choice in our community, which is critically important, I think, for us. So I think we're able to take questions, both Dr. Stoner and I, if there's any that you have. Yes?
What's a hybrid operation?